Hi everyone, welcome to Module 5. We're really getting into the fun stuff now. We've covered quite a bit of information as far as baseline information on epidemiology. Now we're really getting into the nitty-gritty. We took a glimpse within Module 4 of some of the data that's out there that you will find to be valuable tools as you move forward with your practice as well as your work within the D&P program. So what we're getting started to do is actually to give you some of those tools for your toolbox so that you can use them as you move forward. So just a quick overview of Module 5. We're going to, of course, be doing our discussion board, and I'll pop into that in just a minute. You'll be looking at chapters 9 and 11 in your Merrill textbook, and your critique will be due on July the 9th. And please note that there is a screencast-o-matic specifically devoted to the critique. And if you have any questions about that assignment, please let me know. I want this to be a comfortable experience for you. And also we're going to be looking at just a really broad array of information that's out there for you. And basically it's just at your fingertips, and there's some very valuable resources that you can access. So as we move forward, there's a couple of TED Talks that I think that you'll find to be very helpful and help to clarify some of the what seems to be very complex thought processes, and in actuality the TED Talks really help to bring it down to a very simplistic view to help you to kind of think about things such as causality. And many times we think that studies prove certain things, and sometimes they do and sometimes they don't, and many times they don't. And that's something to really hold on to as you move forward, that actually proving causality is very difficult. So just kind of keep that in mind as you move forward. We took a glimpse into the county health rankings and road maps last module. Now we're going to dive into it, and you will find that the data here will be very helpful to you as you move forward with your synthesis assignment. And just know that all this information remains within Module 5, those links that are so important for you to look up some data for your assignment. And if you prefer, I can't talk again today. If you prefer a video overview of the county health rankings, I've included that as well. And this is just an introduction to just basics about the rankings and really how truly complex the experience of health actually is, and looking at multiple factors that actually impact health and multiple factors that need to be considered as you're working on particular population health incentives as well. So, excuse me. And as far as evidence-based practice for population health and looking at bigger groups as far as affecting change in health, there are actually many resources, and these resources are actually within some of the websites. And the thing is, they have been, many of them are based on very sound science, meaning these are just not willy-nilly recommendations. These are actually recommendations that have been studied and examined and gone through peer review, much like you see in the journals, and especially the websites of the Community Guide, which is actually sponsored through the CDC, and What Works for Health in the county health rankings. You'll see that within that particular website, they actually have the levels of evidence indicated. So please know that these are just not general recommendations. These are actually programs that have been assessed and studied and examined and gone through a peer review, much like within the journals. And sometimes there's a misnomer that information that you gain from the internet may not be as rigorous as some of the information in the journals. And in the case of some of the population health incentives and programming, they they are just as rigorous as like the Cochrane reviews and those types of things that actually do a very intensive examination of the different programming. So the key is knowing which ones are based on the science. So I've provided some of those to you, and please hold on to these because these will be very valuable to you. As we move on, we've talked quite a bit about social determinants of health, and this is a fairly classic model as far as the experience of health. So we know that central is the individual, and as we move out to different factors, there are other factors that really play a significant role in the experience of health. And this is Dahlgren and Whitehead's model. And as you can see, that centric is how we're made as far as our age and our sex and those types of things, and then our choices, and then moving out to our social networks and other things that impact our daily lives, and then going into bigger things as far as our living conditions, and then cultural, environmental, and social aspects. And as more and more research is done, it's pretty clear that actually the social, economic, cultural, and on and on and on factors actually have a very significant impact on how we actually experience health. So when we're looking at interventions based on population health, we're looking at those interventions that are extremely effective at the larger level. So we're looking at those major factors that actually impacts individual behaviors versus looking at individual behaviors as the prime source of health experience. I hope that makes sense. If it doesn't, please let me know. That's a real key factor to understand and actually embrace as you move forward. And of course, our critique is coming up due, so I've included some information that's really helpful to you as you do your critique. And I want to show you one particular resource, and just disregard the stuff on the top. But this resource is an open access resource, and it goes into quite a bit of detail as far as bias and confounding. Actually goes into a little more detail than what your book does. So this will be very helpful to you as you're doing your critique. So just kind of keep this in mind and take a look at it. It's a really easy read, and I think it has pretty clear explanations of the different types of bias and looking at confounding as well. So this will help you as you're doing your critique. And of course, I've included the screencast-o-matic specifically on your study critique, so take a look at this as well. And we're going to close this just for a minute, and we're going to go into our discussion board. Hold on now. So here we are at the discussion board, and again, this is where we're really applying what we've already learned. So what we're going to do in this discussion board is a little bit different. We're going to have a little bit of fun. What we're going to do is actually look at a popular health claim and kind of follow the research behind it, and really take a look at whether or not the research behind the health claim is valid and reliable, all those things that we've looked at, and whether the study itself is generalizable to the general public. So many of the health claims that we see are technically based on the science. However, many of them, the science is a little twisted and the interpretation is a little different than what the actual results were, or the studies are very, very small and they don't have the rigor to actually apply to the general public. So I've included an example here for you as far as choosing what health claim you would like to examine. And one of my favorites is Pickles Promote Mental Health. And actually it is based on some of science, based on actually some of the fermented food has some probiotic aspects to it. So they actually gleaned that from a research study and came to the conclusion that pickles or some of the fermented food actually promotes mental health, where it was just a very, very minor finding. So kind of keep that in mind as you move forward. Some of the claims that may be fun to do is something that you may see on Facebook. Some of the Dr. Oz claims are a little far-fetched as far as basing it on research. Again, many times like a rumor, there may be just a wee bit of truth to it, but what we're going to do is take those claims, kind of take that step back and take a look at the research that supports that or maybe doesn't, and look at what is being presented to the public. And that's a real key factor to think about, as many people get their information through media aspects, and as health professionals we need to be able to provide valid information to them, and actually for ourselves sometimes we fall into some of those claims as well. So really looking back at the research and determining that. And you'll also be looking at some of the websites. So just kind of explore those, see what's out there, and see what can help you. So anyway, if you have any questions about this particular discussion board, let me know. But this is a really fun one to take a look at and really look at what's out there and some of the misnomers that are out there as well. So have a great week. Let me know if you need anything. Take care now. Bye-bye.